Hello and welcome. My name is Sandy Shefkin. I am the co-facilitator of the Learning the Language practice group of the IDA Partnership's Community of Practice on School Mental Health, and I'm here along with my co-facilitator, Scott Bloom. Today we will be discussing demystifying the language in Medicaid, and we're very lucky to have Rena Steyaert here as our leading our presentation. Now, our practice group, Learning the Language, is focused on breaking down communication barriers and promoting understanding among all stakeholders to increase school performance and success for all students. To that end, today we are helping to host a webinar, again called Demystifying the Language of Medicaid. Scott and I want to thank the IDA Partnership for sponsoring the webinar, and we want to give our deep gratitude to our speaker, Rena, for leading the presentation. We hope that this webinar helps to connect school mental health services and Medicaid, and that our efforts on exploring communication among the school team members continues well beyond today's presentation. Scott and I invite you to join our Learning the Language practice group through the IDA Partnership website. It will also be given to you at the end of this presentation, but just so you know, it's www.sharedwork.org. We would be happy to answer any questions about our practice group and explain ways to get involved. Our contact information will be posted at the end of this webinar. And now I'm going to turn it over to my co-facilitator, Scott, who's going to tell you a little bit more about the IDA Partnership and our Learning the Language group.
Thank you, Sandy. As part of the IDA Partnership, we have a community of 12 different practice groups that cover different disciplines connecting to school mental health, from educators, families, looking at different kinds of evidence-based treatments, and ours particularly learning the language. The National Community of Practice on School Behavioral Health is a network that bridges mental health and education. Our mission is shared work and common messages across the various disciplines that interface with the school systems. We deal with multiple disciplines and perspectives. Representative partners include, on a national level, federal agencies and organizations, on a state level, technical assistance centers and state teams throughout the country, and last but not least, our local partners. These include family groups, individuals, practitioners, and educators alike. The focus of our community of practice, Learning the Language, deals with the cross-system of shared work. The kinds of things that we put into place and implement are translating policy to practice, aligning goals across agencies, developing common indicators, collaborative training efforts, collecting state and/or local examples, deepening understanding of the various roles and the different practitioners and disciplines, and of course, building relationships through collaborations. We are very much understanding that at almost every meeting that professionals attend, the idea of language and better learning the language and deepening the meaning that is presented at these meetings is paramount in order to do effective collaboration. And now I'd like to go on with our presentation. Our presenter today, Rena Steyaert, is Montana Department of Public Health and Human Services Medicaid School-Based Service Program Officer. She's also the president of the National Alliance for Medicaid in Education, otherwise known as NAME, and president-elect for 2014. So Rena, why don't you go ahead and take us through your presentation.
Thank you, Scott, and thank you, Sandy. As Scott mentioned, my name is Rena Steyaert, and I'm working out of the Montana Department of Health, Public Health and Human Services. And also on top of that, they have the National Alliance for Medicaid in Education. And I wanted to tell you a little bit about that before we get started. As you can see, I've included our website down there underneath that you can get on to and look to learn more about the NAME organization. But I'll tell you really briefly, it is an organization made up of state education leaders, state Medicaid leaders, and individual state local education agencies. We started in 2003, and we bring together professionals who have an interest in Medicaid reimbursement for medically related services in our nation's public schools. We are a professional group of volunteers that co-create products and networking educational opportunities valuable to anyone involved with the Medicaid and education. Our membership is a little over 300 and from every state. NAME is the only organization that promotes networking between Medicaid and education by collaborating our stakeholders, Center for Medicare and Medicaid Services, or CMS, and the Office of Special Education Programs, or OSEP, to develop public policy that supports children's health and education. Membership is $50, and you get access to our bi-monthly newsletter, access to our topical calls and webinars, and ability to attend our annual conferences. So we'll get started with our presentation. I always like to spell out what we're going to try to learn today, or what I'm going to try to tell you. And as you can see on the screen, our main goal is to be able to gain understanding of Medicaid services by recognizing the language we use, and then to develop some of that knowledge about Medicaid and school medical services. And we're going to go over a history of how Medicaid exists in a school-based home. And then we're going to learn how to seek mental health services available in your community. So right now, I believe Mariola was going to try and put up a survey for you all to take with some questions, and I see it's over there under how much do you know. Oh, she moved it over. So if you would take a minute or a few seconds to answer some of those questions, and we'll see our totals come through. It gives me a better idea as to the audience I talk to, as to how much language or lingo that we'll try to use. So we're getting up there, I think. Total 38. So, okay, that's great. I have some knowledge. I think that's our big one. I have a lot of knowledge, 6% is great, and I have none. So we're going to really help out your number one there that has not too much knowledge. So thanks for that. And then we have another question. How much do you know about Medicaid in the school setting in regards to medical services included in mental health services? There's the question there. And I see the answers coming in, so that's good. And we're running about 50, a little over 50% of some knowledge, and 34% or so that don't have any, and 12 that have a lot of knowledge. So we've got a pretty good rounded group in here. So thank you for that. And that gives me, like I said, a better idea of the audience that I'm going to be talking to. So we'll continue. So like I said, we're going to kind of do a little bit of a history lesson on, first of all, what is Medicaid, and then once we understand that, I'll try to move you into the history of how it started. But reading the bullets there, that some states have less than 50% responsibility, and the federal responsibility then would be more than 50%. But Medicaid is basically a federal matching program designed to help reimburse for the health services of low income, which I think we all know. And the history here started in 1965 with Title 19 of our Social Security Act. I'm going to include the Federal Medical Assistance Percentage. We call FMAP, because schools have to use this because it's tied with another government entity, being the school, that when monies are released to that, the result is a reduction of reimbursement that is similar to one done in the community setting and outside of school. So just know that whatever services are being offered in your state and in your school, that part of that payment of those services has what we call the FMAP included in that. And I'm telling you this because it's basically important in the learning of this service to understand all the components of it. And then Medicaid currently serves more than, a roundabout figure, I'm sure it's more than 62 million Americans, just to give you an idea, including 46 million parents and children and 9 million elderly disabled. These numbers were taken about a year ago or so, so I would see that with the Affordable Health Care Act that's be coming into effect across the nation, that these numbers are going to increase. Each state has the authority and responsibility to further design and administer their Medicaid program. And each state has a Medicaid plan which details their eligibility, services that are available, requirements for those providers of those services. It's a pretty extensive plan that CMS reviews and kind of keeps on top of every state's administration. They must follow broad parameters of the federal Medicaid law and regulations, but allow some flexibility so that each state can tailor their program. And it's overseen, like I said, by Centers for Medicare and Medicaid, or CMS. Some services must be covered in each state, such as hospitalization, nursing homes, physician services, family planning, and many more. So again, Medicaid is a national health insurance that is administered differently, and that's one thing I want to really make sure that when we say you understand Medicaid in your state, great, you understand your state's Medicaid. You can't say that you understand another state's Medicaid. So the old saying of you understand one, that's what it is, you understand one. Its use in schools, though, is considered a subset of these Medicaid-covered services available to the clients. And what I mean by that is every state has a state plan, and I'm going to use Montana, for instance, for an example. In Montana, we have a state plan for all of our therapies, our speech, occupational, and physical therapy. When I use those services in our schools, I basically borrow the state plan and how it's written up and run it the same way I would in the community as I would run it in the school. So we basically borrow services that are already, established in your state and run the same type of service and payment system through our school. The services are mandatory for those clients eligible due to federal law that schools and Medicaid have to abide by. And so this adds another layer onto federal laws and rules, which I will present in the next slides, that needs to be understood by schools and providers. The schools being the basis of an education model and not a medical model makes this an education for the schools also. So some common assumptions that we can run with here when we're doing this presentation, that we all are stakeholders and we all agree these things, that children should have a quality education regardless of their abilities, that challenges should be addressed with maintaining respect, and that classroom teachers need support in addressing mental health conditions and its impact on behavior and learning. So why should mental health providers care about all this? First of all, where do our children spend the majority of their days? In a school. And some of those children need help to focus on their schoolwork. Children may be in jeopardy of being suspended or kicked out of school environment due to their behaviors associated with their mental health condition and or lack of treatment. So given those things, once a child, if we get to that extreme one, that once a child is removed from this classroom, they are either suspended for a time and then at home or somewhere not in the schools, and they may also be at risk of being removed from their community at home and home. This does no good for the child, family, or school when we're talking about mental health conditions. And so everybody that's involved with this child's education basically should care and be involved with keeping this child in school and giving them that fair education that is deserved of everyone that attends school. So bridging our mental health in schools and Medicaid. Medicaid is one of the oldest avenues to gain reimbursement in the school, and we'll go through the history to show you why that is. The next slides, like I said, will demonstrate the emergence. Medicaid is not even as old as you will see in the future slides, but it has the most experience in delivery of medical services in a school, whereas other insurance carriers don't have this experience and avenues that have been created. The emergence of the Affordable Health Care Act and the part of every insurance that we've all heard about that needs to have a mental health service in its plan is something we all need to pay attention to and how it develops in that regard, whether it is delivered in a school or outside a school setting. So what is confusing and complicated? What isn't? But first of all, some schools don't participate in Medicaid. I want you to really understand that. Remember how I talked about every state's Medicaid is different? A state may have a school-based service available in their state, but I will use again Montana for an example. Not every one of my schools in Montana choose to participate in Medicaid services, and there's lots of different reasons. And then even some schools that do participate don't fully understand Medicaid. Again, given the education model they're familiar with and having to change into a medical model to understand Medicaid. So there's confusion and reluctance to accept that new service in like mental health, treatment, and counseling in a school setting. The school may recognize the need for mental health services in a school, but the hesitancy of not understanding and thus trusting in the Medicaid and medical model is another hurdle we all face. So wherever there's confusion and complications, we all believe opportunities must exist. So what we're going to try to help you understand through these opportunities is to educate yourself about services in schools and private practices. Advocate for your child, which we all do. Work together in your community, school, and state to access services in schools. And as you'll see later on, that's kind of the stepping stones I'm going to lay out for you, is to start at that level with the community, school, and state to access services. So in the end, children need our help to stay in school so they can receive an education. So the next set of slides is we're going to learn about some specific Medicaid-related language. First of all, we're going to learn about the word EPSDT, or a lot of us will refer to it as EPSD or EPSD. It is called the Early and Periodic Screening Diagnostic Treatment Program. It was added to the Medicaid program in 1967 through amendments to the Title 19 of the Social Security Act, which was started in 1965. What does it do? It provides well child and comprehensive pediatric care for children up to 20 years of age, which includes physical, mental, developmental, dental, hearing, vision, and other screening tests to detect potential problems. A little caveat I found when I was researching EPSD was, why did it start? We say it started in 1967. Well, what prompted that? What I found out was that it was enacted due to high rejection rates for military draftees due to childhood illnesses. So the government saw that rejection rate and thought, well, what are we doing that we're not catching these illnesses and things with children that's causing them to be rejected from our military? I just thought that was a very interesting piece that they enacted this EPSD rule because of that. And like I said, it identifies and treats problems before they become worse and more expensive to treat in adulthood. So some more language about the IDEA and the MCCA and Medicaid put together, and we'll go through what those mean. The Individuals with Disabilities in Education Act, or IDEA, was developed, and I have an error. I apologize. I want you all to mark this out in your thing that it did not start in 1986. IDEA actually started in 1975. as a result of moving children with disabilities into mainstream school settings. In 1988, Congress enacted the Medicare Catastrophic Coverage Act, allowing state Medicaid programs to reimburse school districts for some health and related services in a child's individual education program, or an IEP. The Medicaid program provides some reimbursement to schools for some related services received by children for special education as identified in their IEP. And then Medicaid reimbursement has provided significant assistance to school districts who enroll with their state Medicaid program, and almost every state reimburses school districts. So IDEA put the children with disabilities in the schools with no way to reimburse schools for the added cost of providing a least restrictive environment for these students. MCCA made the connection with reimbursement and the new IEPs that were developed because of the IDEA. So some more about IDEA and Medicaid. There are 4 conditions that must be met for Medicaid to reimburse school districts, and these 4 are, obviously the child has to be receiving the service, must be enrolled in Medicaid. Then the service must be covered in the Medicaid state plan or authorized by the federal statute. Remember we talked about the state plans and how CMS oversees that. Well, we, as Medicaid, have to document our client eligibility, people, the service, how we're going to pay for it, and everything in a state plan. The service must be, of course, in the student's individual education plan or IEP. And then the school must be enrolled or authorized by the state as a qualified Medicaid provider. So when I talked about some services being reimbursed, these are our typical ones we see. I have to apologize, that's my heater. Hopefully it'll be over with in a few minutes. But anyway, some of the services that are reimbursed are speech, occupational, physical, nursing, some Medicaid evaluations, transportation, personal care, your vision and hearing, orientation and mobility specialists for the blind and low vision students, and a school psychologist with the appropriate school credentials. I was fortunate enough to work with my Montana Office of Public Instruction and gained a sample individual education program plan, or an IEP. And I know it's a little blurry, but I'm going to point out where on an IEP you would be able to see if indeed a child that qualified for IDEA also needed in their IEP some behavioral or mental health services. So this is typically a first page of an IEP, and like I said, it's pretty hard to read, but it's basically the child's information, their strengths, concerns, and preferences. There's not a lot on the first page that's going to tell you anything about where behavioral health is a needed service. The next page I've enlarged a little bit, and this is where we're going to start seeing things on an IEP. In the middle of the second page, the special ed related service that says social, emotional, and behavioral. So that's where it's listed on an IEP that we're going to first talk about that. And then, so what is the present level of functional performance and measurable annual goal is. The next one would be a page 3 of an IEP. And again, in the middle section of the page 3, where it lists all special education services. And in this example, you can read the block that says reading, written expression, and then social emotional behavior. We'll mention how many times per week and the period of time the service is to be given on page 3 of an IEP in that special education service section. Then on page 4, the services would have underneath the supplementary aids and services in the middle section. The last statement there is of reminding the student to use the I statements when responding to bullying. Again, this is a mock-up of an IEP, and it appears this child is having difficulty with her behaviors in response to classmates bullying. So this is just one of the supplementary services they wanted to remind this student to do. And then on the last page, and at the bottom of the IEP in the notes section, it mentions that the student's tendencies, I'm afraid I lost the page there. Yep. On the last page at the bottom of the IEP in the notes section, there would be, not mentioned seen on this page, there would be mention of the student's tendencies when getting bullied, and reference to some mental health support would help support the need for the social emotional behavior service type mentioned earlier in the IEP. I apologize, I didn't get what I wanted to show you on there. It must have been above the section, but it was on the last page again where you would see mental health and behavioral health services. So we'll move on to types of reimbursement. Again, more language that I want you to be familiar with when we talk about Medicaid. There's two types across the nation that will be reimbursed when it talks about school-based services. There's probably about a 60-40 degree use of these two types. I would say the 40 would be the fee-for-service, and that's obviously used by some but not all programs. Reimbursement is made based on the actual type and degree of effort given to a service by a specific provider. And then there's another method called the cost-based method. And just for your knowledge, like I said, I wanted to throw those terms out to you so when you are talking to your community and your Medicaid agencies, you will know that there is either one, they pay as a fee-for-service, or two, that they pay as a cost-based method. Both of these, again, are state plan dependent on what state and what plan that they put forth to CMS. So now we know a lot of information. So how do we put it all to use? So one thing we do know is that Medicaid is a health insurance that reimburses for medically necessary services. It's administered in all 52 states by that state's their own state rules and state plan that's overseen. Medicaid's an option for reimbursement for school services. Remember how we talked about that it not necessarily is being utilized by every state, let alone every school in that state. And we know it's made available for Medicaid-eligible kids on IEPs, and that those IEPs list the services we need to have administered through that IEP. And again, mental health services may or may not be listed on that IEP. That's something to watch. That's why I wanted to show you what a sample IEP would look like and where you would add behavioral mental health services for a child that qualifies for IDEA funding. So we talked about the action steps, and kind of we wanted to lay this out for you to be able to say yes, no, go here, go there. So our first question we all have is, does your school participate in Medicaid service claiming? Pretty basic question. We're going to say we find out yes. The next question we would have is, do they include mental health services in their IEPs? Maybe they do, maybe they don't. So we've drawn another part of the map is no. Then find out if they can and would include mental health services in their IEPs. That's a hurdle that we all need to, keep in mind, that just because they do and they do mental health services or they do include them, you're going to find out yes or no. The answer yes then would be to find out how and whom they're doing that service with in your school, if you're interested. they may have it all taken care of, or maybe not to the degree it needs to be, and are interested in doing something, you know, with a contract or outside the school. But those are questions we kind of tried to map out for you. We're going to go down to the bottom one, and unfortunately, when a school participates in Medicaid claiming service and your answer is no, this could be the stopping point for you, because the school chooses not to participate and may not be familiar with claiming at all. Whether you can, you know, convince them that it's something that they should do is another topic. I'm not saying that they should or shouldn't, but at the same time, it's an avenue of reimbursement that I always try to tell my schools. That's an opportunity for you as a school to gain some of the money back. If you think back when we talked about the IDEA and what that did to the schools, it took the children out and put them back into the mainstream schools, and schools were forced to supply all these services that they had to hire staff to do all of a sudden and pay out of their general fund of monies in the school. And the schools realized they were going, you know, not getting ahead at all, because it was an added burden and cost they never appropriated. So that's where we brought up some more regulations in that history to allow the IDEA students now to have some form of reimbursement given back to the schools for those added additional costs. So I think we're at a point now in our presentation of asking the audience if there was anything that generally we could help with. Keep in mind, if it's a state-specific, you know, incident, I'm not sure if we can help you other than to tell you what we've told you now so far, is to work with your school and state and find out where the starting point would be for you. Again, Medicaid's administered by its own state, and state-specific question would be best asked. Do we want to, Scott or Mariola, Scott or Sandy, do we have any questions out there yet? I know it looks like we have a lot. Did you guys want to unmute and ask a question?
You did get a question, Rena, from Mike Scholar. He was asking about, I don't know, Mike, if you want to ask your question yourself or to type it in again so that Rena can see it.
What I see, Sandy, is Mike will FIDA.
Yes.
That's it. That's the question.
What is FIDA, first of all, Scott?
I don't know. Mike, you'll have to type that in.
That's learning the language, so we know each other's abbreviations.
So, Mike, if you can type in what FIDA means, we might try to help you. There, you're typing.
Yeah, he is.
And he's asking about New York, which you had already explained that each state might do it differently.
Yeah, and I'm wondering, there it is, the new Medicaid and Medicare program for New York. Boy.
Medicaid is being redesigned in New York State, and for children, the results of what that will look like is not due until 2016. For adults, it's supposed to begin in 2015. And there are answers to those questions at the New York State Office of Mental Health on their website. And if you just put in Medicaid redesign, you'll be able to find out those answers. There are a lot of PowerPoints. There are a lot of Q&A documents there. Again, it's the New York State Office of Mental Health website, and you'd want to look at Medicaid redesign.
Good answer, Scott. And I think Mike, he is talking about, okay, he says he's familiar with that. So, like I said, does anybody at this point have any questions about where to start with your questions? I'm not saying that you shouldn't start with us, but I'm not sure if we can help. But is everybody pretty much familiar, or do you still have questions about, in your own given situation, where we could help you, direct you to go? And we've got somebody else typing a question, I'm hoping. Okay, if a state doesn't opt for Medicaid expansion, will these services be available? Good question, because in Montana we also did not take the Medicaid expansion. So what I've told my schools, I had the same question in my schools here in Montana, what does Medicaid expansion mean to us? Well, remember, Medicaid expansion was all about, a lot of it was about covering adults that were working part-time or working but maybe didn't have insurance coverage at all because they couldn't afford, or their company didn't offer it. So to expand Medicaid coverage, what that would have done was really go out and grab a lot of uninsured adults that didn't have insurance. So when we talk about children in schools, the Affordable Health Care Act and the Medicaid expansion, I mean, not the Affordable Health Care Act, but the Medicaid expansion really wasn't going to affect schools and students in those schools. And what we did in Montana before the Affordable Health Care Act and the Medicaid expansion was we had a big push, and I think a lot of states did, was to go out and find uninsured kids. And that was through the CHIPRA grants and all the things that came around about CHIP and Medicaid eligibility. And so in Montana, we estimated we had 40,000 uninsured kids in Montana. Granted, we only have about a little over 1 million population-wise, but they identified 40,000. And the last count, with a big push to find these children and get them on some type of insurance, whether it was Medicaid or CHIP. In Montana, we call it Healthy Montana Kids. But to get them on one of those two, I think we ran in a little over 30,000 we found and insured. So I would say we ran close to 3/4 of our uninsured kids we put back on. So another place to look in your state was anything around the children and the CHIPRA money that came out, I would say probably 4 or 5 years ago, to expand that group of kids in the schools, if that helps at all. Did New York or anything do anything around that, Scott, do you know?
Yeah, hi, I had to unmute. Yes, there was a New York State Child Care Plus to help those kids who are uninsured, and that's been out for a while.
Yeah, and so that's kind of where, the Medicaid expansion, like I explained, was more about the uninsured adults. Another question, I'm looking for information for an IEP and the language necessary to connect services we are providing for students to the Medicaid services that are reimbursable. Language necessary. I'm thinking that to work with your school and even the state office of the education department in your state to find out what information or what types of language they would want to see on an IEP. Like I gave you the example of just the social, emotional, behavioral, services needed. And so, each state is going to address, I think, that language in particular differently. And so I think I would direct you probably to your education department to see what would typically be on your state's individual education plans. And I see I've got somebody from my education department here in Montana typing away. So maybe he's got some information for us here. He says, his name is Dick Treerice. Hi, Dick. Those services that are required for a free, appropriate public education need to be in the IEP. So I agree. That's kind of, I was hoping to get that across, that the services are on the IEP, and then the language, I think, would be specific or non-specific, however you want to take that. But work with the education department in your state to see what would be on that. So that's kind of the answer there. Do we have some time for some other questions? Am I not seeing anything here?
Somebody else is typing, but you do have some more time.
Okay.
There's a question there by Frank Ryder. Can you please speak, at least in general terms, about potential functions for which a school or LEA might pursue Medicaid administrative claiming?
We can talk about that. It probably could be a whole nother webinar. Administrative claiming is a different, separate program that deals with payment for administrative work that a school does on behalf of Medicaid. It is somewhat tied into school-based services in general, but also it is more tied into the work the school staff does administratively, like help a family get Medicaid enrollment or help a family understand their Medicaid. So these are school staff functions. And then what has happened is the federal government has realized that instead of putting a Medicaid representative in every school to answer those questions, they understood that the school staff was doing that work for Medicaid and wasn't being reimbursed for it. So they developed this Medicaid administrative claiming program to help offset some of that cost of doing Medicaid's work. And so again, that's a whole nother topic. Is that general enough? Did that answer your question, Frank?
Well, do you have some examples of what those kinds of functions are? You mentioned something about outreach to parents or other kinds of functions that might be billable.
Yeah, in Montana, and we ran a random moment survey, and every staff that's picked to participate, which is not a school teacher because they're hired to teach school, obviously. So participants are chosen on their job titles, and they're somewhat like your administrators for special ed, paraprofessionals, things like that. So there's activities that they can choose they're doing at that random moment time, and there's a few payable ones, and like I mentioned, they're facilitating an application for Medicaid or assisting a family in finding Medicaid payable services or what's available in their community. So, like I said, they're all payable around what Medicaid would normally do if a Medicaid staff was sitting in a school answering those kinds of questions. But since they're not, the school staff is assisting as much as they can, and so we wanted to reimburse them for that. Yes, that was good. General explanation. Thank you. Okay. Thank you, Frank. Are there any federal credential requirements for providing mental health services that are reimbursable by Medicaid? So back it up. Federal credential requirements for providing mental health services reimbursable by Medicaid. Scott or Sandy, do you know of any?
Well, in New York, I think it may be state by state. In New York, you have to have a mental health license, which we call, it's actually part of a law, so it's an Article 28 or an Article 31 license. So I think you'd have to check each state in terms of what the credentials are. And these are typically licensed clinical social workers, psychologists, or psychiatrists.
And I have to agree with that. In Montana, we have presented a few times at your national conference about generalities around mental health and how it's provided in Montana. And one of the things we do is because of a school and it's basically a contracted service, and so there's got to be some oversight done, and with that oversight is our state agency here, our Children's Mental Health Bureau, and they have taken over the oversight of license requirements and the psychologist, and depending on how, again, each state is set up to provide those services, if there's additional people besides a psychologist or a licensed mental health worker, again, I think we're just going to have to direct you back to your state and find out what's available to be offered in your state to begin with, and then keep digging to find out what those credentials are.
Right. The next question is a little complex, but it gets down to the question of some differences in the billing process that might fall under HIPAA versus FERPA. Some school districts think that if they bill Medicaid for services, then every communication, whether it's all written, etc., between school and providers falls under HIPAA with regard to HIPAA data privacy, security, and encryption rules, rather than FERPA. The way I understand it, says Lyon, is FERPA always trumps HIPAA with respect to privacy rules. Through my inquiries, the only thing that might fall under HIPAA is a school district's electronic business office billing for Medicaid using the standard transaction codes. That is, only the actual billing process might fall under HIPAA. What do you know about this?
Lyon, what are you doing asking me this tough question? First of all, what you're saying is pretty much all true. What you found out is that. I'm going to throw another piece in there, and I'm going to throw in the parental consent to bill form that was reauthorized and redid last 2013, of February of 2013. And what Montana did, there's real regulations about a parent signing consent to bill, and it kind of includes some of this HIPAA stuff with it. And on our form in Montana, we go through that HIPAA regulation for that parent to read before they sign off that they want to consent to bill. So what you're saying about HIPAA and FERPA, and yes, HIPAA is just about the billing and the electronic businesses that go on through that and billing through Medicaid in your state. Those are all HIPAA transactions that are agreed to upon enrollment to even bill for the Medicaid services. The school has to agree to all these HIPAA regulations and throughout that. But in digging it down to the parent level, that's where I said the parental consent form that has just been newly developed last February 2013 should address both the HIPAA concern and then the school does its FERPA stuff with the educational records. The HIPAA would be around your medical records. So I probably just threw another monkey wrench out there that nobody understands. But again, education, wanting to know all the pieces and parts, that could be one of this HIPAA, FERPA, confusion. But to understand the parental consent form is part, I believe, that would alleviate the HIPAA concern. Lyon, you're still typing away at me. Not a problem. I love to answer your questions, Lyon. And I have about 1:45, so maybe after Lyon's we can start to finish up, Scott?
Sure.
Okay, there you go. Thanks, Lyon. I appreciate it. So
This is Sandy, Rena. I just wanted to mention that just on this, getting this feedback from all of our listeners, there were so many terms that were thrown out, and I was trying to make a list of them all. Medicaid expansion, administrative claiming, federal credentialing requirements, the HIPAA and FERPA, the FIDA, and I'm just wondering if there's some kind of like easy, not easy, but simple language kind of brochure or Q&A or something maybe geared towards families so that it can connect all these issues to help with demystifying it so that I know I would benefit from it, and maybe some of the other people on the line would. I mean, is there something like that that's a link to something that you could share with us? Or is it something maybe as a work group, as a practice group, we should be looking at more carefully about trying to develop something like that?
As far as a link and one developed, I don't know of one that would include the vast array of terms we have used. So maybe I think your suggestion of the practice group developing one for this, whether we do it in advance of the conference, which I know is still quite a ways away, or you could have a really quick conference about the language, again, demystifying and make it just about terminology and or if you want to develop one in advance of conference and send it out. It wouldn't be too hard to do. I would, can help you with understanding all those. But yeah, these last ones that came in as questions, I understand the HIPAA, the FERPA, and all this other stuff. So thanks for writing them down. I think it's something we can work on.
Okay, thank you.
So I'll just keep moving. To wrap up then is to understand what's behind Medicaid being available in the school was our first step to learning the language, and then finding the correct resources in your community and state and being able to speak the language, which I hope I helped out and didn't confuse you some more, but if you learned some of the language, I think would help eliminate confusion and delays in your work. And then working towards implementing a service in your community is, of course, our goal. And we have a couple more survey questions, and if Mariola can help me get those up, we'd like to just get a feel if this webinar helped. And so the first question is, of course, did it give you some inspiration and direction to go in your community and state with the questions we've had? Wow, 11 people. There we go. Keep going. No, I'm glad it did, and I hope it did educate. And like I say, inspired you to get started if you're really running into roadblocks and spots where you just don't know where to turn to next. So okay, I think if you want to, oh, it's closed. Okay, so that was good. The next question we had then is if no, I'm not sure, Mariola, did we leave that open to type in some more additional questions? I don't know if we'll have time to answer them here, but at least we'll get an idea what your question may have been. So we'll wait a few minutes here. Or a minute
Rena, I was wondering if you could reiterate a little bit about the name organization, if that is a place where people can go to for further kinds of Medicaid questions that you might be able to facilitate.
Thanks, Scott. What I foreseen with my president-elect status and working the last few years with this organization and seeing the hurdles, the questions that keep coming out, I believe NAME would be a good asset if you don't even come to conference and learn about individual stuff. I think being a member to NAME would benefit you we host 2 topical calls a year, and to me it's like a webinar where we have a topic of interest and we produce it and we have speakers. So being able to get on and listen to things that may be of interest to you, and bi-monthly newsletters kind of tells you what we're doing, what we're at. And the emphasis with that is because we work so close with CMS. They come and attend our conferences. We can ask them questions, and if they don't answer them spot on, they will return those question answers to us in a format. So to get a direct answer from CMS is greatly appreciated in our worlds that we work in. And like I said, we work directly with the state Medicaid directors group. We work with the state special ed directors groups. So I believe that anything, you can always pose questions to us, and if we find, and I think we're finding more and more that mental health is becoming more and more hard to understand and how it's going to be delivered. So I believe NAME could be a great resource for any of you that would be of interest. And you don't necessarily need to be a state education leader or a state Medicaid leader or a local education agency in itself, a school. You can also join us, and we have a group of people that we call Friends of NAME that get the same benefits of being one of those 3 people I talked about. So any of, if you didn't fit to those 3 membership criteria, then certainly join for the $50 and have access to us. And if the conference happens to be in your state, this year we are in Niagara Falls in the fall, and I believe we are right at the same time you guys are having your conference. And is it in Philadelphia, Scott?
Pittsburgh.
Pittsburgh.
Pittsburgh. I get those two mixed up. Sorry. I'm sorry. It's anyway the same week, so that's a tough one there. We don't try to hold them on the same weeks, but obviously we try to go in the fall. And then next year, I think we're looking at the Baltimore, D.C. area. And then in 2016, our conference will be held in Montana. So that's the far out future, I can tell you. So again, I think it's a great opportunity. It's networking, it's working with schools, the state level people, it's networking with them. We also hold regional town halls where we've divided our membership into regions across the nation. So you can come and sit in a town hall meeting and hear what's specifically happening in your region and not as an overall nation. But we have town hall meetings at our conferences, and it's a great place to network with a neighboring state, find out what they're doing in their education and Medicaid departments. So again, how'd that sound, Scott? Did that kind of run by what NAME is for?
Sure. That was useful.
There you go. Thank you, Scott. September
And
18th and 20th in Pittsburgh. Yep, we can't forget to plug this group for this reason. So I think we'll be ready to move on. We did the last couple surveys. Sandy or Scott, did you guys want to grab this page about the shared work?
This is a screenshot of the shared work site of the IDA partnership. Again, it's www.sharedwork.org. And you can see that there's lots of activity that's sponsored through the IDA partnership on this website, message boards, announcements, polls, lots of ways to get involved. Scott and our information, our email addresses are listed on the next slide for you to be able to reach us. And we really encourage, I mean, I learned a lot in this presentation today, and maybe a next step for our work group to take about having some a more examination of some of the language affiliated with Medicaid to help with further understanding. And Rena, I just wanted to mention that I just heard from an occupational therapy practitioner today who had a lot of questions about writing team-based goals, which is what related services do under IDEA in the schools, yet for their plan of care for Medicaid, they're being asked to come up with separate OT goals. And so she was asking me some questions about that. So I think there's a lot that we can learn from affiliating with NAME and understanding more about what are some of the challenges and opportunities in terms of working together. So we really want to thank you, Scott and I, Rena, for leading such a wonderful presentation today. And we want to thank the IDA partnership for sponsoring it. And we want to thank all of our listeners for spending their time today to join us. And we want to just make an invitation for you to come to the Pittsburgh conference and come to the Learning the Language track. And we'll be exploring this topic and others about language and intersecting mental health and education, language in schools.
Great. Thank you, everyone.
Thanks.